This film was made for the Association of Reflexologists at a Rima Shah Maternity Reflexology seminar in June 2010 at the CBI Centre, London.
My name is Rima Shah. I'm a multidisciplinary holistic therapist. I've designed this maternity reflexology diploma due to demand from various different practitioners who wanted a more detailed course. I have to say I actually love my job. I always think that I'm very fortunate, and for me it's just the fact that I can actually make such a difference in people's lives by doing very little, I feel. You're just offering somebody a little bit of relaxation and a bit of time out, and often just an ear. They just need to talk to somebody, but that added to the benefits of reflexology just makes such a difference to them. Reflexology is something that my aunt used to do. She trained in it many, many years ago in India and then brought it to Britain with her. And then from that, I used to get my pressure points done all the time when I was a child for little things. And then I've always been interested in complementary health. I mean, even as a teenager, I was very interested in essential oils as well as reflexology. And then I did my degree. And then after that, I went on, came out and graduated, and there was no work available. So my dad actually said to me, why don't you go and train and do reflexology as a diploma, which is how it came about at the time. I've been working in the complementary health industry for about 13 years. I initially did my holistic massage training and then went into reflexology and then specialised in maternity reflexology due to demand from clients. I found more and more and more that I was getting clients who were either trying to get pregnant or who were pregnant or were, going to go into labour, and I just felt that it would be more professional for me to go and get further training in it, which is what I went and did, and then from that, from my experience, then went on to develop the course as well. The reflexology is amazing. There's always new techniques out there, there's always new skills that you can add, and CPD is, firstly, it's a professional level that you need to sort of have as part of your toolbox anyway, but also it helps your clients, because you're offering them something new all the time and offering them the best for them, really, which is what we want to do as reflexologists. Today I've taught various different methods of using reflexology. With those points, we covered fertility, conception, pregnancy, a bit on labour and a bit on postnatal, but mostly pregnancy. Adapting it towards clients who might come in with conception problems or pregnancy mostly. Most of the day's been about pregnancy. And then sort of adapting the treatments and a couple of new techniques that delegates could take away and use themselves, and hopefully encouraging them to go and progress and do a course in maternity reflexology if that's what they want to now specialise in.
And do that a few times, because this is a really nice way to warm up. If you focus quite a lot on that area, on the pelvic area, because we're concentrating on pelvis, give it a little gentle squeeze. It's almost like giving it a little massage. So I'm sort of squeezing with my heel and then with my fingers, alternate. If you have your posture's changed for whatever reason, you've been carrying lots of heavy bags, or you've been sitting awkwardly and your pelvis has been tilted incorrectly, these areas can be very sore.
One of the key things that I have taught that people can take away is how to sort of work along the pelvis and to ease a lot of the pelvic pain that can occur during pregnancy, because that's usually one of the big things. So it's working using new sort of massage techniques as well as the reflexology points to help relax and ease the pelvis.
If you find the malleolus, it's about 3 fingers width up, and you'll sometimes, like this one, you can feel a little very gentle dip, because it'll be very tight all the way up the Achilles, and then you get there and you can feel. This is spleen 6, this point. And then on the other side, if you look between the ankle bone, like the malleolus, and the Achilles tendon, sort of, it's in a little dip there. This is bladder 60, bladder 60. The way that I would work those, if I'll demonstrate on my arm, you would literally just go in and gently press so that you can see the indentation of your, but don't go in deep, 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 so it will probably be quite sore, especially that spleen 6 point can be very, very tender. And just hold it for a count of 10. And then let go. And then go back in and just do it once more. Hold it, count of 10, and let go. And the second time should be less painful for them than the first time.
The difference between standard reflexology and maternity reflexology is mostly adapting the treatments according to the individual person's needs. So in pregnancy, that would be understanding the anatomy, physiology and pathology changes, also the contraindications that are involved, changing positions as well, and being safe and being professional is mostly it.
Have a go on people who aren't pregnant, on finding these points before you go in and start treating people who are, but take it on an individual basis. Remember to talk to your clients, discuss it with them. It's their treatment, so it has to be a mutual decision as to what's happening. Give them knowledge. Remember, knowledge is their friend, it's your friend too.
This maternity diploma that I teach is of a higher level than of a standard reflexology diploma, as it's a CPD course and it's a postgraduate course for anyone who wants to specialise in maternity reflexology. CPD courses are very important to keep up the professional standards of someone's training and to ensure that you are learning all the time and sort of enhancing your toolbox as such. You can't make any claims with maternity reflexology. However, all my clients do express how amazing they find the maternity reflexology and how much more relaxed they are. The difference between the AOR seminar and one of my workshops is the AOR seminar is an introduction to maternity reflexology. The course itself is covered over 4 days and we go into far more detail with the anatomy, the physiology and the pathology, as well as specific techniques for each area. So we concentrate far more on all of the different areas, including conception, fertility, labour and postnatal, as well as the pregnancy itself. The importance of CPD is, firstly, it's a professional requirement, but secondly, if you're newly qualified or you're like me and you've been qualified for 13 years, you're still learning all the time and you're always constantly adding to your toolbox, and there's so many new techniques and skills out there that it's very important just to keep adding to that, just also to help your clients as well, as best you can. If you want to know more about the maternity reflexology diploma that I'm offering, you can go to my website, which is www.binditherapyschool.com, or you can also go to the AOR's website where they have a link directly to that as well. There is a big maternity reflexology conference happening on the 6th and 7th of November. It's being run by a number of the top maternity reflexology trainers in the country, and there's going to be lots of speakers and lots of workshops that you can attend.
This film was made by Jonathan Mitchell for the Association of Reflexologists, copyright 2010.